Welcome to our channel Medicine A to Z. Today we are going to discuss the diagnosis of hypertension, different types of blood pressure measurements, office or clinic blood pressure, home blood pressure, ambulatory daytime blood pressure, ambulatory night blood pressure, ambulatory 24 hours blood pressure, how to take accurate BP reading. Patient relaxes in a chair for more than 5 minutes. Patient avoids caffeine, exercise, and smoking for at least 30 minutes before. Patient empties their bladder before measurement. No talking during rest or measurement by patient or observer. Remove clothing covering cuff placement. Don't measure while patient is sitting or lying on an examining table. What is the proper technique of blood pressure measuring? Use a validated blood pressure device and calibrate it regularly. Support the patient's arm, like resting it on a desk. Place the cuff's midpoint on the upper arm at the level of the right atrium. Ensure the cuff size is appropriate, covering 80% of the arm, and note any deviation. Use either the stethoscope diaphragm or bell for readings. Office or clinic blood pressure. Office or clinic blood pressure refers to the measurement of blood pressure taken in a medical setting, such as a doctor's office or a clinic. Home blood pressure monitoring involves regularly measuring one's blood pressure outside of a medical setting, typically at home. Use a validated, automated device to measure blood pressure in the upper arm. Take measurements in a quiet room after 5 minutes of rest, seated with back and arms supported and legs uncrossed. Aim for 12 to 14 measurements over a week, both morning and evening. Home readings correlate better with 24-hour monitoring and target organ damage than office readings. If office and home readings differ, use ABPM if possible to confirm home readings. Ambulatory 24-hour blood pressure monitoring, ABPM, is a method used to continuously measure a person's blood pressure over a 24-hour period while they go about their daily activities. Best way to diagnose hypertension and white coat hypertension. ABPM is not widely available but gives more accurate results than office readings. It records blood pressure regularly, like every 15 to 20 minutes during the day and every 30 to 60 minutes at night. ABPM can find white coat and masked hypertension. Consider ABPM for suspected episodic hypertension, checking medication effectiveness, low blood pressure symptoms on medication, resistant hypertension, autonomic dysfunction, or suspected masked hypertension. According to the American College of Cardiology, American Heart Association, normal blood pressure, systolic BP, less than 120 mmHg, and diastolic less than 80 mmHg. Elevated blood pressure. Systolic BP is between 120 to 129 mmHg and diastolic BP less than 80 mmHg. Stage 1. Hypertension. Systolic is between 130 to 139 mmHg or diastolic 80 to 89 mmHg. Stage 2. Hypertension. Systolic at least 140 mmHg or diastolic at least 90 mmHg. According to the NICE, National Institute for Health and Care Excellence guidelines, the diagnosis of hypertension in adults is confirmed when clinic blood pressure readings are 140/90 mmHg or higher, ambulatory blood pressure monitoring, ABPM daytime average or home blood pressure monitoring, HBPM average is 135/85 mmHg or higher. Isolated systolic hypertension, defined as a blood pressure reading where the systolic blood pressure is 130 mmHg or higher and the diastolic blood pressure is less than 80 mmHg. Isolated diastolic hypertension, defined as a blood pressure reading where the systolic blood pressure is less than 130 mmHg and the diastolic blood pressure is 80 mmHg or higher. Ambulatory or home BP monitoring. The diagnosis of hypertension requires integration of home or ambulatory blood pressure monitoring, ABPM, whereas routine measurements made in the clinical setting should be used primarily for detection purposes. Regarding automated BP apparatus, check the pulse in the wrist or upper arm before using automated devices. If there's an irregular pulse, like an atrial fibrillation, manually measure blood pressure. Listen directly over the upper arm artery with a stethoscope for accurate readings. White coat hypertension. White coat hypertension is defined as blood pressure that is consistently elevated by office readings, but does not meet diagnostic criteria for hypertension based upon out-of-office readings, masked hypertension. Masked hypertension is defined as blood pressure that is consistently elevated by out-of-office measurements, but does not meet the criteria for hypertension based upon office readings. Diagnosis of hypertension. Diagnose hypertension. If systolic blood pressure is greater than 180 mmHg, or diastolic blood pressure is greater than 120 mmHg, or there's a hypertensive emergency. From Remain, diagnose hypertension if SBP is greater than 160 mmHg, or DBP is greater than 100 mmHg, and the patient has ischemic heart disease, IHD, heart failure, left ventricular hypertrophy, LVH, chronic kidney disease, CKD, cerebrovascular disease, or hypertensive retinopathy. For patients who don't meet these criteria, monitoring should be initiated. For individuals who don't fall into the previous categories, monitoring their blood pressure becomes crucial. Home blood pressure monitoring and ambulatory blood pressure monitoring are the primary methods used. Home blood pressure monitoring. If a person's mean systolic blood pressure measures 130 mmHg or higher, and/or their diastolic blood pressure is greater than 80 mmHg, hypertension can be diagnosed. Remain can be white coat hypertension. If blood pressure readings are elevated in a clinical setting but normal elsewhere, it could indicate white coat hypertension. In such cases, monitoring in an ambulatory setup is recommended. Ambulatory blood pressure monitoring. For those monitored through ambulatory blood pressure monitoring, hypertension is diagnosed if the SBP consistently reads higher than 130 mmHg and/or the DBP consistently reads higher than 80 mmHg during monitoring. If readings fall below these levels, they're categorized as normotensive but still require follow-up. For individuals unable to use home or ambulatory monitoring methods, 3 separate clinic blood pressure readings should be taken over weeks or months. Hypertension is diagnosed if the average SBP is greater than 130 mmHg or the average DBP is greater than 80 mmHg.